Hi, my name's Johnny, and I'm going to demonstrate patient education on stroke. The things I'm going to cover is what is a stroke and how it happens, what are the signs and things to look for, and what you should do if you see someone having a stroke. I'll also be covering some risk factors and what puts individuals more prone to having a stroke. So over this, stroke affects nearly 800,000 Americans every year, and of those 800,000, 140,000 of them actually pass away and die. A stroke happens in two ways, but the main way the stroke affects you is blood flow is cut off to a certain part of your brain, and without this oxygen and blood, the cells start to die within minutes. The two ways that the stroke can happen is you can have something that will block the blood flow to the brain, or you can have like an internal bleed and start bleeding inside of your brain, kind of where your arteries will actually, which carry blood in your brain, will actually rupture, and then they'll start leaking blood into your brain and not be in kind of like that tube that they're in to help perfuse that in there. So when looking at stroke, we need to look at the risk factors. Almost 80% of strokes are preventable through lifestyle factors such as healthy diet and exercise. 19% of strokes happen in individuals who are younger than 55, so most strokes happen in elderly adults. Some of the main risk factors for stroke are poor genes, diabetes, elevated blood pressure, because I know blood pressure is directly related to stroke. So as your blood pressure goes up, so does your risk for stroke. So these are two in there. Being overweight is another big risk factor. Smoking and any previous head trauma are the big things. So when looking at individuals who you think may have a stroke, you need to look for these signs. So the main sign is going to be individuals, and they can have any of these. So any of these are big warning sign. If they're having sudden onset of trouble with vision, slurred speech, or weakness on one side of their body. So either they're not able to use their left side, left-sided facial droop or right-sided facial droop. They're starting to be confused. They're not talking right. These are all warning signs that you need to get them to the hospital right away. The big reason is every minute counts with a stroke. There's medication out there that can reverse them depending on which type of stroke it is, and that can really help reverse all their symptoms that they're having. So when you see people having a stroke, you don't want to waste any time. You want to call 911, get the ambulance there, have them take them over there. You want to make sure you stay with the patient and prevent them from falling or doing any other damage to themselves. And don't offer them any medications, no food or drinks, because they could choke on this. They may have problems swallowing. So these are the main points coming in there on how to recognize a stroke. I would, of course, ask any questions or see if there's anything that they're concerned about. But the big thing is when you see these strokes, these warning signs, you want to make sure time is the most important factor of a stroke, making sure you get them to the hospital as soon as you can. Thank you.